So, I'm Dr. John. I'm a neuropsychologist, and I want to welcome you to the first ever Understanding the Exceptional Mind podcast. But I don't want you to think of these as podcasts in the traditional sense. We are simply going to have conversations, and what I believe are very important conversations. Conversations that focus on how the mental health system is fundamentally broken. The ways we diagnose psychological, psychiatric disorders is fundamentally flawed. It is theoretically flawed. And this is the reason why the interventions we're using in the various mental health systems are not working. So, over the last 20 years, as I've gone through my career, I've developed a greater and greater passion for changing the systems. Because through my experiences, whether that was as a school psychologist or a clinical psychologist, I was seeing time and time again how the ways in which we were interacting with our patients or our students, the ways we were diagnosing or identifying their differences were not working. And therefore, the intervention systems that we have in place are not working, whether they're pharmaceutical, whether they're therapeutic, whether they're counseling. These interventions simply have not worked. And through this passion, I formed the community Understanding Exceptional. And the community at its heart is about creating positive change to improve the human experience for anyone and everyone. But in order to create positive change, we have to understand what is flawed in these systems, and therefore, how do we correct those things? What can we do to better understand the human experience, human behavior, so that we can achieve our ultimate goal of creating situations where the human experience is better for everyone. So I'm incredibly excited to get this thing kicked off, and I want to invite you to join the community at Understanding Exceptional, whether that's understandingexceptional.com or through any of our social media platforms. Additionally, I said we're not really going to be doing a podcast per se. These are going to be conversations, and conversations that are interactive. So I want the community involved. If you have a comment, leave a comment. If you have a question, leave a question. I want connection and communication. These conversations are going to be honest. At times they might be controversial. We may delve into topics where people disagree. But through these conversations, we are going to figure out why the systems are operating the way they are, why the systems are failing too many, and then ultimately look to create systems and scenarios and interventions that benefit everyone. So I'm really excited to get this thing going. And let's start with an incredibly nerdy topic, which is one of my favorites, the human brain. Now, I'd be willing to argue that the human brain is the most interesting thing in the entire universe. I don't know how it could be any other way. I don't know how you could argue against that. In fact, if you think about it, the universe fails to exist, it ceases to exist without the human brain. Here's what I mean by that. I've got my awesome dog, Iggy. Well, as smart as he is, and the reality is I'd never know what he's actually thinking, I doubt he's contemplating what's out there in the universe or what his role is in the entirety of this existence. I think he's more focused on the treats in the cabinet, taking a ride with us wherever we're going, or sharing love. I mean, that is his passion, just love and energy, like lots of dogs. But I don't think he's at a high level contemplating anything outside of sort of the immediate. So therefore, in order to have a universe, we have to have a human brain. Now to go a little bit deeper here, therefore, the universe is actually inside of all of us. If you can't think of the universe, have conceptualizations of what it may be, what may be out there, what reality is, well, then it doesn't exist. And herein lies one of the more important concepts in all of psychology and psychiatry. And it's one of the reasons why the systems themselves are failing so many. We never know what another individual's internal experiences are. We can only know what they show us through their behavior. So as we delve deeper into how and why the systems are broken, this is a critical concept to understand. I can never know what you're thinking right now. In fact, I can ask you questions, and through a process of behavior or movement, you can give me information that's inaccurate and is not representing what you're actually thinking. For example, if I were to say, what do you think of this first podcast? How am I doing? Is it interesting? Are you in? Are you going to follow along? You're going to have some thoughts that are generated. And among those thoughts might be, what is he talking about? This isn't making a lot of sense. He's all over the place. But what you're going to do is through a process of regulation, you may very well pull from your social file in your brain and say, Dr. John, you're doing an amazing job. So at the end of the day, the behavior that you have showed me, you're doing an amazing job, Dr. John, is not indicative or accurate or representative of what your experience is. And this is hugely important to understand, and we're going to delve much deeper into this throughout the various conversations we have through the Understanding Exceptional community. So now we need to unpack, where does the human experience come from? And for me, like I said, this is where it gets super interesting. The human brain, absolutely fascinating. And the brain is very, very complex, and it has numerous different connections and systems. But at the end of the day, the brain only has to do 3 things to create our experience or to create a behavior. The 3 things the brain has to do is operate sensory systems, regulate those sensory systems, and then produce movement. Very, very important. That is it. As complex as the brain may be, as many structures as there may be, it only does 3 things to create a human experience. And if we see behavior, the behavior of those we love, if we see it through the lens of, well, you can't have a behavior unless you have a brain, we need to always recognize that. There is no behavior without a brain. This table, no behavior, no brain. So whenever we see a behavior, particularly a behavior we want to change, well, we should start with the source of that behavior. The brain is always the source. The behavior is therefore the symptom or the outcome. So we have to sense information in our brains. We have to regulate it, and then we create movement. So let's go into those 3 different systems and unpack how they create our reality. The most important systems we have in our brain are those sensory systems. Without sensory systems, your experiences, your reality ceases to exist. Sensory systems include things we see, things we hear, things we feel. They even include experiences related to movement and rotation, things we smell. So what the sensory system does first and foremost is it must process sensations. It must process what we see, what we hear, what we feel, what we smell. So the processing is the foundational aspect of the human experience, and it's found in those sensory systems. The second thing that the sensory systems needs to do to create our reality is associate sensations. So let me give you an example. You have a 1-year-old, and during that period of time, they're developing language. So how does language develop? Well, we're going to pair sensations. So in this example, the kiddo is standing in their living room, and the family dog comes running in, wagging its tail. And mom and dad point to the dog and say, "Doggy." And so the 1-year-old directs their attention to the dog. They're seeing visually the dog. They're hearing doggy, and they're making that association. That visual sensory input is associated with the auditory sensory input of doggy. So there is an association, a sound visual or sound symbol association. We then store those associations. And it is critical to once again understand that the entirety of the human experience is a sensory experience. Intelligence, as we think of it, those are sensory experiences and producing sensory information. Our emotions, the way we think, all of our inner thoughts, anything and everything you can think of that makes you human really begins in our sensory systems. So these are by far and away the most important experiences and systems and structures in our brain, the sensory structures. So what else do we need to have a human experience? Something has to regulate what's happening in our sensory systems. So we have regulatory structures. The regulatory structures are located below, in the deep middle, and in the front part of the brain. And so what these regulatory structures do for us is they manage the activity of our sensory systems by turning our sensory systems up, turning them down, connecting them, or disconnecting them. So we have to have a process by which something's managing all of the sensations we take in. We cannot take it all in at once. So we need a manager, we need a regulator. And so these regulatory structures are critical, but they are only managing our experiences. They're not creating it. And what we're going to talk about in future conversations is that in the vast majority of diagnoses out there, it is the regulatory systems of our brain that are operating inconsistently. When we're talking about neurodivergence, almost all of neurodivergence involves something in the regulatory systems where the regulation of those sensory systems tends to be polarized. People can be hyper-regulated, hyper-attentive, hyper-focused, learn at high levels, and in other situations really struggle to sustain attention, struggle to learn. I'll give you a quick example of how the regulatory structures are really the source of almost all the diagnoses, but let's take a common one, ADHD. So in ADHD, Johnny has been diagnosed with ADHD, so that means he cannot pay attention, right? Wrong. In my practice, all I have to do is ask Johnny's parents, okay, he's been diagnosed with ADHD, and you're here for some more information. How does Johnny do when he's playing his video games? How does he do when he's playing with his Legos? How does he do when he's doing something he really enjoys? Invariably, parents say, oh my goodness, Dr. John, when he's doing something he enjoys, he's on his video games, we cannot get him off of them. We call his name, he doesn't turn around. After 3 hours of sitting perfectly still, he comes to us and he can break down every second of what he did. He remembers it all. So if we look at behavior through the right lens, now we can extrapolate that attention's not broken, it's not disordered, it is not dysfunctional from the standpoint of he doesn't have access to it, but it is highly variable. The regulation of his sensations, his attention being where am I going to focus what I'm looking at? What am I going to focus on in terms of listening? Where am I going to focus my sensory energy in this moment? So the regulation structures are responsible for that. And when you start to see variability in how those operate, we will start to arrive at different diagnoses. And this is a whole separate conversation about this continuum of regulation difficulties. I call it the regulation disorder continuum. And we'll talk more about that because it really explains almost all of the common diagnoses out there. And it certainly bears talking about. So sensory. We have a sensory system in our brain or sensory systems. Their responsibility is to process, associate, and store. Now we have regulatory systems that manage the activity of those sensory systems, where we're going to allocate attention, how we're going to access information in our sensory systems, what we're going to attend to and not attend to, inhibit, how we're going to manage our movement, right? So sensory, regulatory, and the final set of responsibilities for the human brain to create an experience is our motor output systems. Now, these are very interesting because at the end of the day, all of human behavior, anything you know about behavior, is nothing more than movement. And movement is nothing more than an outflow of the activity of our sensory and regulatory systems. So behavior, motor output, is a indication, the motor output is an indication of what's happening in our sensory and regulatory systems. So therefore, motor output only gives us a finite sort of peek into what is actually happening in those systems. And yet, as psychologists and psychiatrists and those in mental health, we only look at movement. As an example, my speaking is nothing more than movement. So through my process of speaking to you right now, what's happening is there's activity in my sensory systems. My regulatory systems are managing aspects of that, deciding which words to pull out. And through a process of movement, my speaking is nothing more than movement. I'm moving air out of my lungs, I'm vibrating my vocal cords, I'm moving mouth structures, and I'm sending airwaves your way. And you're taking those airwaves through your device, and those airwaves are being turned into words in your sensory systems. You're turning the words into sentences, and you're understanding what it is I'm saying, or you're understanding what you're looking at if you're looking at subtitles. So you're using your sensory systems through the management of your regulatory systems to understand reality. So our motor output systems are absolutely simply the result of what's happening in our sensory and regulatory systems. Here's why this is super important. We can fool people regarding what's happening in our sensory systems using our regulatory systems through what we show them, through our movement. I gave you the example earlier. If I were to ask you, what are you thinking of this conversation? Are you glad you took the time to listen in? Is it meaningful? Are you enjoying it? Is it making sense? Lots of stuff will now happen in those sensory systems of yours. You're getting visual information, you're getting auditory information, you're integrating all of that, you're understanding it. So now your regulator has some choices regarding different thoughts that may be occurring. And many regulators dip into the sensory system and say, all right, among those thoughts, I better go to the socially appropriate one. So now through your movement systems, you, if you were sitting here in front of me, might very well say, again, amazing, wow, this is fantastic, super interesting. You're laser focused, which I never am. So great job, Dr. John. But you may actually be thinking quite the opposite. He is all over the place. I'm not understanding this. He's repeating himself. I want to get out of here. How much longer is this guy going to talk to me? So in other words, through your movement, through your behavior, you have presented to me a reality that is not what you're actually experiencing. So now as we transition into the fundamental flaws in our diagnostic systems and the reasons that the mental health systems and the interventions we're using are so ineffective in so many cases, is psychiatrists, psychologists, mental health providers only have access to movement. They only have access to behavior. And yet, we are making profoundly important determinations based on people's behavior. So let's take one step backwards here. Let's think of our behavior, our motor output, as a symptom, whereas our brain, our sensory and regulatory systems, are the sources of all of our experiences. Behaviors reflect or inaccurately reflect what's happening in our brains. So our brains are always the source of behavior. It cannot be any other way. No matter what anyone has ever told you, you gotta have a brain to have behavior, period. So if we have a behavior that we want to change or that's concerning, or if we have a human experience that's being communicated through behavior, someone is anxious or they're depressed or things are challenging for them, they're going to communicate that through a process of behavior, through a process of movement. If our goal is to change the human experience for the better, to adjust behaviors for the better, we absolutely have to focus on the source of those experiences and of those behaviors. And the source can only be the brain. And yet, whenever I provide a diagnosis to a family, all I can do is look at the behavior, get some data regarding what may be happening in one's sensory and regulatory systems, and then psychology, psychiatry, the professionals in those systems, the mental health systems, try to jam those behaviors, those symptoms into a word. And then based on the word, now, okay, we really know what we need to do to intervene and to support this individual. But those are just symptoms. And we show people very little about what we actually experience throughout any given day. How much of your experiences in any given day are you verbalizing or communicating through some type of behavior? Very, very little. Your reality is so much greater than your behaviors show me. And this is a profoundly important concept because this reality has been fundamentally ignored by the systems, which is why the systems of psychiatry and psychology and mental health have missed the mark for since their inception. And there's lots of talk out there about finding cures or finding the causes. Let's just take autism spectrum disorder. We have to keep in mind that you have to have a brain to have behaviors that we could call or associate with autism spectrum disorder. So we know the brain's a starting point, and now we sort of develop ideas around what behaviors might be associated with that diagnosis. And then based on the diagnosis, here again, we provide what we think will be effective interventions or treatments. But what we're trying to do currently is, and the rumblings out there now are related to Tylenol as an example. So we're never going, if the goal is to find the cure, which it should always be, if someone needs their human experience changed for the better, we need to do everything we can to provide them that opportunity. However, if we're going to look for the sources of the behaviors themselves, we should start with the brain. So those out there in the scientific community that are saying we're going to find the cause of autism, and they're starting to point their fingers at things like Tylenol, they're starting at the wrong spot because they're not considering that you have to have a brain first. And so what we need to do, if we want to find the cures, what we must do first is we must figure out what are the brain structures that result in the profile of behaviors or the internal experiences as much as we can extrapolate from an individual. But what are the brain structures that are operating differently that cause those experiences or those behaviors? I'm telling you right now, and mark my words, and anyone out there in the scientific community, as high level as you can be, if you want to debate or have a conversation about this, I am telling you right now that the brain structures are the regulatory structures that cause the behaviors that we have now associated with autism spectrum disorder. We are going to land on the connections between the cerebellum and the middle structures of the basal ganglia, but that's a different conversation, a conversation for another time. But those will be the structures involved that result in the profile of behaviors that we have now assigned autism spectrum disorder to. So we need to start figuring out what might be impacting the development of those structures or the functioning of those structures. So let's take this example of Tylenol. A mom takes Tylenol while she's pregnant, right? And so then they suggest through their studies that, well, individuals diagnosed with autism spectrum disorder, a large percentage of their mothers were given Tylenol when they were pregnant or during the child's gestational term. And so since there's a larger percentage than the general population of those who were given Tylenol, and now we have children diagnosed with autism spectrum disorder, must be the Tylenol. For me, that's a rather ridiculous supposition, and here's why. Why was mom given Tylenol? Was she having a headache? Did she have a bacterial infection? Did she have a viral infection? What were her physiological experiences that potentially could have altered how that child's brain developed or functions? Were there things that mom experienced that might have caused inflammation in the brain, particularly in those regulatory structures, that now as the child develops, they start to show the behaviors associated with autism spectrum disorder? But until these individuals in the highest level scientific communities start recognizing that these words are simply descriptions of the behaviors, but behaviors are only symptoms of our brain. And so until they pivot backwards to the brain, we will never figure out the cause of these conditions. We have to start with the brain. So this just sort of exemplifies the idea that the system itself is looking at these things through a lens that absolutely predicts that if we continue to do it this way and use these rather ridiculous terms that aren't real, bear with me for a moment. If we're using these diagnostic terms that aren't real and have never really existed, and then based on that diagnostic term, which is nothing more than a symptom description, we're trying to create treatments or interventions that'll be effective, we're doomed. And this is why the system has failed for so many. Let's go into objective sciences where they recognize that you have to focus on the source and not the symptoms. Let's take a medical situation. If you have a fever, you have a sore throat, aches and pains, chills. Well, those are your symptoms. You're not going to your medical provider is not going to diagnose you with a sore throat. Here's the lozenge. Yeah, you do have a fever. Here's your Tylenol. You tell me you have the chills, throw a sweatshirt on, and you have aches and pains, take it easy. They're going to say, well, those are your symptoms, and those are important, but if we're going to find the right intervention, we need to know what's causing those symptoms, not just that the symptoms are present. That doesn't do us any good diagnostically. So let's figure out, is this viral? Because that'll be one protocol of treatment. Is this bacterial? Be a different protocol of treatment. Is this allergies? That would be a different protocol of treatment or intervention. So it's always the source that matters, not the symptoms. And so psychology and psychiatry, we are symptom identifiers, and then we pretend that these words, because we have identified the symptoms, even though we argue incessantly over, I think it's ADHD with anxiety. Oh, absolutely not. This is depression with anxiety, which looks like it's never any of these. It's always the human brain. For the 500 different diagnoses that you can describe a mental illness, the 500 different ways, and then thousands of iterations of those that you can tell somebody they have a mental illness. The reality is none of those have ever really existed. Everyone who has ever had a word put next to them, a diagnosis, every one of those individuals, I promise you this, has a brain. And something in the brain is operating differently, which is changing their experience. And a lot of times those experiences are very unpleasant. So I'm not minimizing the impact of the human experience. But this idea that we can have an experience without a brain is utterly ridiculous. And our behaviors also then, therefore, reflect what's happening in our brain. As the final example, to drive home the idea, I mentioned that these diagnoses are not real. That's going to be a rather controversial statement, but it's accurate. Here's how I know they're not real. In the history of mankind, we have never done a cheek swab and grown ADHD. Mom and Dad, I did the swab, got a little ADHD. We know what to do now. We're all set. We can't blood test for things like dyslexia or depression. We can't do brain scans. Even genetic testing isn't going to tell us what the diagnosis is. So we don't have any objective means, like they do in medicine, to determine what the diagnosis is. So now we're left with, we're going to argue over what are the behaviors representing in terms of a diagnosis. How do we put a word around the behavior? And let's all argue with it. I cannot tell you how many times I worked as a school psychologist for 15 years, and now in the private realm, how many times the clinical professionals argue over what it's called. And this blows my mind. And this is part of why I created Understanding Exceptional. Because I don't understand, why are we arguing over the word? Because no one did a blood test, no one did a hair follicle test, didn't swab a cheek. These things are real, they are not real. So why don't we understand what the behaviors are, consider what may be going on in that brain, what are those behaviors communicating about their internal experience, and can we just agree on things that might be needed to support this individual? And then we should go backwards from there to, all right, what do we call it to make sure this individual has the right tools, the right interventions to achieve happiness, health, and success, to change their human experience for the better. But we don't do that. We argue, and so many times in these school meetings and in outside of school meetings, the clinicians go back and forth over what it's called. And it is just utterly perplexing to me, because we should just be laser focused on what do we know about what's occurring, what are we seeing, and how do we help. So the words themselves are not real. Now, and I want comments, because this whole thing is about conversation. If you disagree, let me know. If you have ideas, fire away. Conversation and honest conversation is the only way we're going to get where we need to go. The honest conversations where we're open to talking about any subject, nothing is off limits, controversial, whether people agree or disagree. We have to have dialogue to change the human experience for the better, because the systems are fundamentally broken. And so there may be people out there that say, hey, you can do genetic testing and identify autism, or you can do a brain scan or brain imaging and identify this, that, or the other thing. So let's start with genetic testing. What's really being expressed there is there are, in fact, genetic conditions that we know change how the brain regulates itself. It changes the development and functioning of regulatory structures. So we know that the brain systems have been altered by certain genetic conditions. Therefore, we see behaviors that oftentimes are consistent with something like autism spectrum disorder. But it's not the behaviors that represent autism spectrum disorder. It is the brain systems that precede those behaviors, the changing of the brain systems and structures that underlie regulation. It is autism spectrum disorder, ADHD, anxiety, Tourette's, aspects of depression, aspects of dyslexia, reading. All of these things at the end of the day are going to come down to the interplay between our regulatory systems and our sensory systems. I promise you that's the case, and we'll have that conversation in a future podcast. It is the regulatory systems that are changed through that genetic disorder. So the genetics didn't cause the behaviors, the brain did. So I'm very redundant, my own regulation, not fantastic. So you'll see me repeat myself, kind of go all over the place. But this is my neurology in my brain, and it's represented through my behaviors. So there's also people out there that are claiming, well, we can do a brain scan and tell you if it's bipolar disorder, or tell you, no, they can't. That's snake oil. What they're really looking at is they're looking at metabolic properties or the activity of the brain. And what they're going to find is that the sensory systems oftentimes are overactive because the regulatory systems are not operating consistently. So remember, nothing we speak about, I don't know that I've mentioned this to this point, but when we talk about behavior, we're almost never talking about a complete absence of the behavior. I gave you the example of ADHD, a diagnosis. I mean, who in the world doesn't know someone or doesn't have ADHD? And the reason why ADHD is so common is that whenever there's a change to the brain, the first thing that's impacted are your regulatory structures, and you're going to manifest that through your motor output systems. So many things can take your regulatory structures kind of offline. If you're super hungry, it's harder to pay attention. It's harder to learn. If you're angry, it's harder to pay attention. It's harder to inhibit. If you're very tired, it's harder to pay attention. It's harder to inhibit. If you're very bright, which most people who are neurodivergent, we're going to talk about that, are incredibly bright. We've associated these ridiculous words with something being wrong, pathology. This is part of the problem with the system. The system says if you are not what we call typical, something wrong with you. And that's absolutely wrong. I'm not suggesting the experience itself is pleasant, nor am I suggesting that some of these conditions, as we diagnose them, aren't very disruptive to daily living and overall functioning. And some of them can be catastrophic. But there are things we can do to help individuals. But we're going to really drill down and fine-tune interventions once we use the right lens regarding what behavior is and how humans experience the world. And that is only through the brain. And so as we sort of traverse this road and kind of come to an end here, the idea that there are genetic or metabolic tests or brain functioning or brain imaging tests that can tell us whether or not we're going to have dyslexia or autism or whatever it may be, it's not real. Now, we can get it to be real, but we need to get to the point where we're fundamentally and solely focused on the brain, and then we really understand what structures do what, how changes in those structures change human experience and change behavior. What are the external things that might change how those brain structures develop and function, particularly the regulatory structures? So if a vaccine has a likelihood to cause inflammation, which may change how a brain regulates, we can start to correlate then that vaccine may increase the likelihood of these behaviors, which we've associated with this diagnosis. If there are processed foods, if there are things in the environment that are changing how our brains develop and function, thereby causing behaviors and experiences that are different, and we've assigned to these words, we are going to be much more efficient in creating scenarios where we can change a person's experience and or behaviors for the better. So again, as I draw closer to concluding in this section, this dynamic between the brain and behavior and human experience is absolutely critical. So let's summarize. The human experience is unbelievably complex, but your experience is your experience and mine is mine. And I can never know what you're actually thinking or feeling other than through your process of movement or your behavior. You can tell me what you're thinking. You can show me what you're thinking. But even through those, I still don't know, because again, you can tell me or show me something that's not actually representing how you're thinking or what your experience is. So we can use movement to fool people in that regard. The most important thing for the understanding exceptional community, and my passion for the last 20 years because of my frustrations being a neuropsychologist, the most important thing is we have to start understanding the realities of human behavior and human experience. We have to use the right lens. If we're going to look at a behavior, if we're going to understand the human experience, we have to use the right lens of interpretation. And the lens always has to take us back to the brain. And we now have to recognize that the behaviors we see, the movements we see, are not always indicative, and a lot of times they're totally the opposite of what a person's experiences actually are. This is incredibly important because in my practice, this is one of the greatest frustrations that parents and the kids and teens and young adults I work with experience, is that their behaviors don't adequately reflect what they're actually experiencing. So let me give you an example. If I have a child that comes in and they're very frustrated in school, and so a parent comes in and says, Janie is really overwhelmed at school. Now, teachers all love her, but she's struggling a little bit in reading and writing. She tends to be kind of overwhelmed at times. But her teachers love her because she sits there quietly with a smile on her face and is looking at the teachers and paying attention and all the things you want from a student, right? And so then the parents come in and say, but there's something going on here, because the moment Janie gets into her car, it is an emotional explosion. So what's happening there? Here's what's happening. Janie, who's an amazing human being and has amazing parents, what she's doing is she's regulating throughout the day. So here's what I mean by that. Her sitting there, making eye contact, paying attention, smile on her face. She is controlling through her regulatory systems the outflow of her behavior. So a teacher looks at Janie, We all love Janie. I think she's very happy. She's got a smile on her face. But this young lady is super frustrated because although she's hanging in there with reading, it's not where it needs to be. And she is very worried about the upcoming test, and she's a little overwhelmed by some of the kids in the classroom. And she really, in her internal experience, she just wants to get out of the classroom, get the heck out of here, and I'm just overwhelmed. But teachers look at Janie and go, we love her, she's great. Mom and Dad, there's nothing going on. Yeah, you must be exaggerating it. When she gets home, she's really emotional. No, come on. She's doing great. We love her. But that's exactly what's happening. Janie is overwhelmed. Maybe she's frustrated with reading and writing. The sensory environment is overwhelming to her. So because she's a benevolent, lovely human being that desires to be cooperative and not call negative attention to herself socially or otherwise, she just regulates all day and she just burns through regulatory energy. The moment she gets in the car, a fly lands on her knee and there's an emotional explosion. And then parents, oh my gosh, and they tell me it takes us 3 hours just to get her down to where, we can have a conversation with her. So she's just emoting. She's just pushing out all of all of these experiences she's held in throughout the day. This is hugely important because when you have a system that only looks at behaviors, psychiatry, psychology, mental health, we only look at behaviors. And then we have a lot of people in these fields. We have some wonderful people, but the system itself is a very narcissistic system. Our assumption is that our eyeballs and these numbers that we derive through these tests are reflective of your experiences. I know your experiences. You told me. I ran some tests. I had you do some rating skills. This is who you are. So this is what we need to do. We're going to call it, this is what we need to do. How in the world do I know what your experiences are? I never will. You will never know my true experiences. I will never know yours, other than through a process of movement. But like we've talked about, we can use movement to fool people. So now, as a neuropsychologist, when I'm working with these kiddos, I have to explain to teachers, and these are wonderful people, that what you see from Janie in the classroom isn't her reality. Those behaviors are not reflecting her experiences. And so I now need to, through a process of evaluation, provide numbers to demonstrate to them how and why I came to that conclusion, and to shine a light on the fact that what other people show us isn't necessarily their experiences. So in a system where we only look at symptoms to diagnose, those who are benevolent, those who have wonderful parents, and those who regulate, a lot of times get overlooked because they aren't showing us the behaviors that, oh, that's ADHD, that's anxiety. So therefore, these kids and these individuals commonly get overlooked. And that's where I come in. I want to make sure, I don't want to pathologize or make somebody out to be, have all these disorders, but I certainly want to have everyone looking through the same lens and a clear lens regarding what their actual internal experiences are, and make sure that if everyone understands that, and we can get to a process where we can identify the tools of support that allow Janie to put in the effort she needs to put in. Success always requires effort. So any diagnosis does not eliminate the reality that we have to work hard. I tell my families this all the time. Effort is not removed from the calculation of success ever. Has to be there. But there's a huge number of people, because of the way their brains work, where they need to apply their effort differently to get to the outcomes, the behaviors they desire and deserve. So we need to start to adopt systems of understanding humans where we, one, recognize can't have a human experience, can't have a behavior without a brain. And we get to the point where we recognize different brains do things differently. Effort should always be the expectation, have to follow the rules, have to put forth effort. But what if there are tools that we can use where if an individual applies that effort that's required in different ways to get to the outcome they desire and deserve? Learning is an outcome. Effort is an expectation. So we can apply our effort based on the way our brains have developed and function. If we can use different tools where we apply our effort in different ways using the systems that we have to achieve the same outcome, why are we as a society concerned about that? Why do we ever go, well, no, there's a right way to learn reading, writing, and math. There's a right way to do this. And that's the one way. And if you do it outside of that, well, you need to go talk to Dr. Mather. He'll give you a word that lets us know something's wrong. Then we'll put the tools in so that we can apply the effort differently to get to the outcomes we desire and deserve. This is another point and another profoundly impactful reality as it relates to the broken diagnostic systems and the broken mental health systems. There's too much of this idea that these individuals, through the observation of behaviors, understand your experience. And when we do it that way, we are going to continue to perpetuate this idea that, oh, this is what I see. I'm a psychologist. Listen to me. I know you. I know what's happening inside of you. I never do. I'm going to call it this. Now we know what to do. How in the world can I ever know? We have to get back to that brain. I want to provide you a quick example of the effort to outcome equation or the ratio. So one of the things we'll talk about in future conversations is that internal motivation, or if we find something interesting or rewarding or meaningful, or if we're persistent and well regulated during an activity, typically that means it's internally motivating. And what do I mean by that? If we're doing, again, something that's interesting, rewarding, meaningful, something we're good at, what's actually happening, what motivation really is through our experiences, the effort we've put in has been equivalent to the outcomes we desire or the success we desire and deserve. So when we put in effort and that effort leads to success or outcomes that we desire and deserve, we're going to be motivated. So let's flip that. If we put a lot of effort into something, but our outcomes don't reflect that effort, it starts to get frustrating and we start to lose motivation. The example I give to parents all the time, it's rather ridiculous, but I think it brings home the point. Let's take an outcome that I desire. I want to build my upper body strength. So that's an outcome. Now, I have to put in effort to do that, right? So I go down the street to my local gym, but they're a traditional gym. They do things the right way, the old school way. We're going to use bar, but we're going to do it the right way. This is how we've always done it. This is going to be a game changer for you. So I go there and I'm introduced to a trainer and I say, look, I really want to build my upper body strength for various reasons. And so I'd like to put together a program that helps me to do that. Trainer says that, my goodness, that's super easy. We've got the right way to do that. So let's get you started here. Why don't you go, I want you to lay down on that bench there and we're gonna have you do a bench press. Well, what I'll do is I'll stack some weights on there. You'll pull the bar off and I wanna see how many times you can get it up. Now, especially this is true with kids when we can't share our realities. This trainer does not allow me to tell him or her, actually I have an elbow injury. So if I extend my elbow past a certain point, there's pain, and now I've lost the ability to move, and so the pain is going to be very disruptive if I do. But I'm not allowed to articulate that, and so I go down on the bench press thinking, uh-oh, this is not good. And they put the typical amount of weight on the bar. People are standing around watching, and I can't even get it up. I'm in pain. My elbow won't allow me to lift it, and so the trainer is going to look at me and go, yikes, okay, we're starting pretty low here. You're not very strong. So the intervention will be, I'm making these observations. I'm seeing through your behavior, you're not very strong. What we normally do is someone that would come in, we'd have them do 3 sets. We'd establish their weight and do 3 sets. But since you're so weak, we're actually going to have you do 5 sets. So you're going to do more, all right? So you've already embarrassed yourself because you're so weak. And our solution is, our intervention is, well, because you're struggling, you got to do more, right? Great. So now what's going to happen to my effort to outcome ratio or that equation is going to be out of balance. I'm still going to try to put in the effort, but my outcomes are going to be disastrous. They're going to be far below my capabilities. And so I'm going to quickly lose motivation to go to this gym and to do the bench press. They're going to tell me, well, the bench press is the right way to do it. It's how I built my muscle, the trainer says. It's how most people did it. We've done it this way forever. It's the right way. You got to do it that way. That is inaccurate. So in that example, if this trainer would have said, yeah, we have a machine over here, you don't have to take your arms down as low. If they would have allowed me to apply the same amount of effort, so effort remained in the equation. If I apply the same amount of effort over here that I did to the bench press, not only would I show this trainer how darn strong I am, but when I'm using this machine, I'm going to build my upper body strength robustly and efficiently. So I get to show what my capabilities are through my effort using this alternative machine, and I get to achieve the levels of success effectively and efficiently. And so this underscores the idea that there are different ways to apply our effort, because effort's an expectation to achieve the successes we desire and we deserve. Now, what's happened in these systems, whether they're educational systems, particularly the educational systems, we've adopted this idea that there's a right way and a wrong way. And it just so happens that what's been sort of codified or established as the right way was developed 100 plus years ago. This is how you read, this is how you write, this is how you do math. That's not correct. There are different ways to apply effort, and different brains learn to read in different ways. And that'll be a future conversation we're going to have about dyslexia. What is it? How do you know if a kiddo has it? And then what do we do? Because dyslexia is not a broken brain that can't read, even though it might say disorder or disability. Dyslexia is fundamentally a brain that has connections that are different. And those connections result in the need for different methods of learning sound and symbol relationships so that we can decode words or identify whole words, or different ways that our brains take all that information in and comprehend what we've read. So again, when we use words that suggest something is wrong, and that's what the system has created, and this is the other aspect of the system that is a total disaster, is that anyone that doesn't use the bench press, that's the right way, you shouldn't have to use the machine because the bench press is the right way. So if you need this machine to build upper body, well, there's got to be something wrong. There's nothing wrong with me. I do it differently. That is not the right way. It works for a lot of people. Great. Get on there and do it if it works for you, trainer. So this is one of the primary flaws in our diagnostic system. They're going to tell you that in order to use different tools, to use a different machine where you can apply your effort to get to the success and outcomes you desire and deserve, in order to access those tools, something's got to be wrong with you. Go to Dr. John. He's going to tell you what's wrong with your kid, and then you can have the tools. Why have we created that system? Why have we created a system that anytime we do it differently, because of our neurology, we have to call it something negative, a disorder, a disability, a mental illness? The book that I use to diagnose, in the title of the book, is mental illness. I cannot provide a single word that doesn't imply mental illness. And the reality is, this is where we have to arrive when we're talking about neurodivergence. I'm not a super fluffy guy in terms of terms that are in vogue, but my goodness, neurodivergence has hit the nail on the head, because we're not talking about neurodisability, neurodisorder, neuromental illness. We're talking about brains that are wired differently. And those systems that operate differently mean that sometimes the way we apply effort, the way we do things, is going to be different than the masses, the typical, the normal, the average, whatever that means. And so when you have a diagnostic system that, one, only looks at the symptoms, the behaviors, two, now says if your behaviors aren't like everyone else's, you're not using the bench press, there's something wrong with you. So let's figure out what's wrong with you. And now let's rotate into, once we know what's wrong with you, once someone tells us you don't do it like we do it, we're going to help you out. We'll get the tools there. Now you've created a scenario where, number one, the diagnoses are inaccurate. They're not objective. They are all subjective. And you create a scenario where the diagnosis itself suggests there's something wrong. Now, I can't move any further without absolutely addressing the idea that, once again, there are brains that develop in ways, and there are events that impact how the brains develop and function that result in experiences that are very, very challenging. And so, again, none of this is about minimizing anything. It's simply about bringing a community together of individuals that want to really understand the realities of the human experience and human behavior, so that when we want to make changes through tools, we're better equipped to do so. But if we continue to use the systems that are in place, the educational systems, the diagnostic systems that rely solely on behavior, that say, if you don't do it the right way, the way we've established, you're doing it the wrong way and there's something wrong with you, we are doomed to continue to perpetuate this cycle of not providing human beings what they need to be successful. So to sort of drill down on the conclusions here and to move this into the next topic and to set the stage for future conversations, let's summarize briefly. The human experience cannot occur without a brain. You cannot think, you cannot speak, you cannot feel. None of those behaviors or experiences will ever occur without your brain. So the brain is the starting point or the source of all of your experience and all of your behaviors. At the end of the day, behaviors are nothing more than movement. So what we see from other people through their systems of movement can give us indications of what may be going on in the brain, but it is far from representing their reality. And there's so much more going on in any human than what their movement may show us. When we have diagnostic systems that only rely on behaviors, we are doomed to use diagnoses that do not capture the reality of what a human's experiences are. Therefore, if we're using terms that have never existed, they're not objective. If we're using terms to allow individuals to have interventions, but the terms do nothing to identify the source, is it surprising that the interventions aren't working? Is it surprising that despite all of the money and the movement towards better mental health and to support those that we love and to create better experiences, is it surprising that in a system that ignores what's actually happening, that those interventions are ineffective in many cases? It shouldn't be. If you have a sore throat, a fever, aches and pains, and the chills, and I keep giving you a Tylenol, a lozenge, and tell you to put your sweatshirt back on, well, I'm going to give you a short-term intervention, perhaps. I have not addressed the source. And until we start addressing the source, we are not going to get to a place where we can find cures or find what is causing these things. So this is hugely important. This is my passion project. These ideas have been rolling around in my head and really bothering me for the last 20 years, these broken systems. It's really caused me to be fundamentally embarrassed to do what I do. When I tell somebody I'm a neuropsychologist, they make assumptions about, oh my gosh, you're probably analyzing me and you probably do amazing things and work with serial killers and these types of things. I am sitting before you today not because I'm proud to be a neuropsychologist and in the field of psychology. I am fundamentally embarrassed because the system is so broken and I cannot take it anymore. And so understanding exceptional is that passion project. And I want to bring anyone and everyone in. Nothing is off limits. It is conversations. Agree with me, disagree with me, make a comment, put in a topic that we need to discuss to get us to a place where we can create human experiences that are better for everyone that wants one. I hope you will join me. If you thought this was thought-provoking, if you thought it was annoying, if I was totally wrong, if you agreed, leave a comment, do all the social media stuff, thumbs up, thumbs down, leave a comment, drop in a question, an idea, and we'll get to it. So I can't thank you enough for joining me on this first one. This is going to be a process. I need to refine this a little bit. As with anything, when you first start out, it's a little raw. I know I took us down a variety of roads, but hopefully some of them were entertaining. Hopefully some of them were informative, thought-provoking, and let's get there together. Let's get to creating better realities for everyone because we all deserve that. So if you thought this was thought-provoking, if I'm wrong, if you thought I was right, if you have an idea, leave a comment, leave a question, give me a topic that we need to explore to get us to that better human experience for everyone. And come and join us at understandingexceptional.com on all our social media platforms. Subscribe, do the things that you need to do to be part of this proactive community of communication, of exploration, of taking chances, of driving humanity towards a better place. Thank you for hanging in there with me through this first iteration here. A little raw, a little disorganized, a little tangential. That's kind of me. But there's going to be amazing conversations going forward, and I can't wait to see you there. Thanks again.